Welcome back to the What's Next Longevity Innovation Summit. I'm Fred Fishkin, Mary's co-host on the What's Next Living Longer, Better, Smarter podcast. In this summit session, post-pandemic investments and innovators to bridge the digital divide and address social determinants of health. Our moderators are Lance Robertson, Director of Healthcare at Guidehouse and former U.S. Assistant Secretary for Aging and ACL Administrator, and Mary Furlong, President of Mary Furlong and Associates. And on the panel are Lawrence Kosick, co-founder of Get Set Up, Doris Schooler, co-founder and CEO of Intuition Robotics, Abby Levy, managing partner of Primetime Partners, and Greg Olson, acting director of the New York State Office for the Aging. Let's turn to Mary to get things underway.
I pride ourselves on our ability to spot talent. And when we first met Lance Robertson, I knew it was talent, and talent who really understood how Washington worked. So we were so pleased to have Lance come in as our co-host for this conference, and also his deep understanding of social determinants of health. So Lance, I'm going to turn it over to you.
Oh, thank you, Mary. You're very gracious. And I have to also applaud your leadership and foresight. It seems like every time we talk, you've got about 4 or 5 great things in the pipeline. So I'm excited, and I'm glad that we, of course, have a strong participation, a diverse participation, both in terms of those listening in and enjoying this panel. And then, of course, our panelists. As Fred had introduced, we have a variety of thought leaders and folks that have really walked the walk and have made a difference. And I'm just so proud to be a part of this group. So thanks again, Mary, and thanks to the panel. Of course, I think all of us recognize social determinants of health. It remains a very timely and critical topic. And for me, when I am often asked, what are you talking about when you say social determinants of health? And we do have a number of definitions out there, but I try to keep it simple. So for me, I'm talking about the non-medical, high impact, low cost interventions that routinely support independence, better overall health, and community living. So that's kind of the Lance definition, but I think it resonates across many of the conversations I've been honored to have in my work at the federal government level and working with Congress as a state leader, and then of course as an advocate, just making sure that people understand and appreciate the importance of this. And really for me, I'm just pleased to say that there has never been, to my knowledge, more emphasis and more support than we're seeing today in supporting social determinants of health. And I think that's excellent and overdue. So I'm really happy to just kind of highlight a couple of quick things that I want to make sure all of you are aware of. First of all, really proud that Congress has now stepped up. We've been working over the last number of years to help Congress understand and appreciate the value and the impact of social determinants. And just recently, if you've not heard, Congress launched a caucus that is dedicated to social determinants of health. So you can just Google it at your leisure, SDOH caucus, and you can find that there's a lot of new and growing activity in this conversation for those that work and are key leaders on Capitol Hill. There are 4 co-chairs to the caucus, and I'm proud to say as an Oklahoman that 2 of the co-chairs are from Oklahoma. And again, I can just honestly tell you, I had a little bit of influence in encouraging those people to really step to the table, and I'm proud of them. And I'm really excited to see what Congress decides to do in supporting this critical conversation. And of course, really from our federal partners, so many that I could name, I'll focus on my former federal agency, the Administration for Community Living. Obviously, at the very center of our work is an appreciation for the social determinants, and really a number of programs. If you go to acl.gov, you can see more about things like one of the initiatives that we launched recently called Commit to Connect, which addresses social isolation, but again, through a lot of different SDOH pathways, a lot of training and different webinars, and just so many offerings that our federal partners now are stepping up and being directly engaged and involved in making sure that that SDOH support is there. And then finally, as an example, never before have I seen from major payers and the large ones who are now investing in social determinants of work and paying for it because they see the payoff, they see the end result. They know that these, again, low cost, high impact services are worth the investment because it keeps people at home. It helps people stay healthy longer. And at the end of the day, it's a win-win proposition. So briefly in my history about championing this work, I worked again as one of the leaders in the Department of Health and Human Services and worked directly with Secretary Alex Azar, and he had 4 priorities. One of his priorities or pillars involved value-based care. So we had a conversation early on. I said, Mr. Secretary, if we're really going to stand up this particular priority, we've got to focus on social determinants. So he said, Lance, tell me more. So we had a great conversation. That was the beginning of many conversations where I helped emphasize to the secretary, it's the informal, community-driven sort of services that are going to make a difference if you really want to talk about potentially impacting that value-based care conversation and bending that cost curve. And then, of course, from there, worked very closely with agencies like CMS. And, over the last couple of years, you've seen some real movement and traction around supporting social determinants of health. You can look up the Medicare Supplemental Benefits Memo, which talks about, again, Medicare paying for some of those social determinants activities. And then also Medicaid, CMCS put out a toolkit. Again, a couple of different things you can really anchor to in seeing the federal government support for this critical conversation. So I am just super excited, and I am a relentless advocate. I think the timing again of this is great, and the conversation couldn't be better in terms of just really understanding and appreciating that the secret sauce, in my opinion, for managing our nation's health is through this type of conversation. I think it's our chance now to be proactive and to continue to push that decision makers understand and invest in the social determinants. So with us today has been introduced, we have a great panel. Really excited about these 4 colleagues. And again, they all come from a slightly different sector perspective. You have, private industry, you have state government. And again, these folks are really doing great, critical, exciting work. So we're honored to have them. And I'm going to start off by handing it over to a good friend of mine, a gentleman that has served for a number of years now as a director of aging services for the state of New York. That's a big responsibility. Greg has managed it well. So proud to have Greg Olson on with us. Greg, the floor is yours, sir.
Well, great. And thanks, Lance. Your leadership at ACL and your continued push on this issue, I'm going to say is legendary because it is. And this is a real fantastic panel. There's a lot to cover in 5 or so minutes, but Lance is exactly right. Social determinants of health is yet another industry term that it's hard to figure out what it is until you know what it is. But the overwhelming majority of healthcare costs have nothing to do with a health condition. They have to do with where you live. Are you exercising? Are you taking care of yourself? Do you have fresh air to breathe, et cetera? The network that Lance oversaw nationally, and I'm one of 50 state Unit on Aging directors, we've been doing this work for 50 years. And one of the newer things that has come out, at least from the state of New York, is real important data and outcomes metrics on the return on investment when you link clinical services and wrap around social determinants of services or those services that Lance talked about in the community, whether they be nutrition, transportation, caregiver support, legal assistance, affordable housing, and so on and so forth. So when you can actually show the value, improved outcomes, improved quality of life for individuals, savings in Medicare and Medicaid, and be able to show those types of things, I think you can move along. So this is really about the digital divide and thinking about our priorities and what the future is and why I'm excited now after 30 years of being in this network that this is a change of time is because during the pandemic, the recognition of state units on aging, the aging network, and many of our partners, both public and private, was not demonstrated more effectively than during this pandemic. And that has shown with the investments in stimulus dollars, the proposed investments to the Older Americans Act, many other parts of ARPA funding and other funding that address other areas that all need to be knitted together, and connecting the dots and working with other people is really the name of the game. So, why are states like New York able to, move the ball and be innovative? Same reason why Lance and Lawrence and Dor and Abby and others, good leadership and the willingness to say, I can't do this alone. I have to have partners. There's plenty of work to go around, and turf is not an issue. The customer is the most important thing to me, and everything else you work backwards from. And as long as you have your eye on the prize, that's the key. So what we're doing here in New York is a couple of things. First of all, you have to have access to equipment, Wi-Fi, and know how to use it. And I'm really excited about the federal infrastructure bill that's going to provide additional access all over the country to be able to access this type of technology. And that's going to be great. There's been a lot of things that we've done here in New York that I'm really proud of, that we're going to continue to ramp up and support, and to develop new partnerships. And, Lawrence is certainly one of those. I'm not going to take his thunder because he's going to talk in a minute. But before we can even access technology or address the gap in a digital divide, people need to have access. You need to know who can use it, who can't use it, and what those reasons are. So as part of our comprehensive assessment, we've added not only a tech check to be able to analyze if an individual or their support structures can utilize technology platforms, so that we can connect them to those types of services and resources. But we also added a social isolation screen so that those things are interconnected. If you're isolated and you can use technology, there's so many platforms like Get Set Up and others that I'll mention in a second. So that's the first and foremost, the most important thing is access, training, helping to purchase equipment, subsidizing Wi-Fi if necessary, but really working at the ground level to make sure people have what they need in order to use these things. It's not going to be 100% the solution, but it's an important tool in the toolbox that we will have now forever, and is the future of not only aging, but is the future of healthcare. We've partnered with many, many companies, public and private alike, to stand up some real innovative platforms. We partnered with Get Set Up and prepaid for 50,000 classes for anybody over the age of 50 in New York State to be able to connect with people, reduce their isolation, lifelong learning, and also provide an economic opportunity for people over the age of 50 to share their skills. We've partnered with Self-Help and the Virtual Senior Center in New York City to pilot their model in 14 counties in New York State. We are launching a project with GoGo Grandparent out of California, which uses technological platforms to provide a transportation option for older adults, as well as an economic opportunity for older adults to join the gig economy. We're about ready to launch a project with an organization called Pets Together that use live pets to break the ice and connect isolated individuals to others, using the pet as that icebreaker. In the caregiving realm, we've partnered with T-Care, Trualta, Caring Wire, and Archangels out of Massachusetts for the Caregiver Intensity Index to provide not only training and assistance, but a variety of tools for caregivers directly and for staff that work with caregivers to be able to support them and provide them the resources when they need them to continue to do their jobs. We're working with a company called Blooming Health, which is really focusing in on the non-smartphone market for individuals that still receive text messages and SMS messages, to be able to communicate with individuals through that mechanism, which I think is a really nice bridge. Everybody is familiar with our award-winning animatronic pet project, using that technology to reduce isolation, depression, and pain. We're going to continue that. We are working with a couple of organizations in a pilot to merge together clinical care and social determinants by using a platform that has a 24/7 emergency room, 24/7 physicians access, sensors and monitors in the home, 24/7 caregiver support, financial protections for individuals and their bank accounts, and then wrapping around all that the Office for the Aging does to really meet people where they are, address them holistically, and merge together clinical and non-clinical care. And then on the training side, and then I'll wrap up, there's a variety of platforms we use to provide direct and indirect training. We're about ready to launch a statewide project with the National Association of Home Builders. Why them? Because they have a really robust certified aging in place specialist certification that we are going to offer to our case managers and others so that they can evaluate and make recommendations in the care plan on safety and better ways to change the built environment to help with aging in place. And then we've had a long-standing relationship with Boston University Center for Aging and Disability Research, where we provide over 27 online trainings and certifications for our case managers and many others in the network. We plan on substantially expanding those in the coming budget year. On the budget side, there are stimulus dollars, state resources, there's Build Back Better with potential additional funding for the types of services that we provide, as well as the infrastructure bill. And really the only thing that would be lacking is the leadership from counterparts like myself, businesses that are here today and others that want to partner to just pull the trigger and get things done so that we can serve individuals the best way that we can and their families in their homes and communities where they want to be, to improve their quality of life, but also have all of those metrics on cost savings and good health outcomes. So glad to be here. Such a timely conversation, and really looking forward to everybody else's commitment to this issue as well.
Wow, Greg, awesome. What a load of information. Thank you. I took a bunch of notes. I really, really wish you would partner more. I think you're sort of being a little, no, I'm just kidding. Phenomenal. What a great list of examples. And I know there's probably not a comprehensive list knowing you, Greg, but that's a great highlight of some of the many, many things. And again, I think Greg, as really a national leader, I think demonstrates the importance of working together. And again, making this all happen is always going to be dependent on a team of more than just a single individual. So Greg, thanks so much for your leadership. I can't wait until we have time for questions because I have a bunch for you. So we do want to transition though and make sure that we cover, again, some excellent information from the other three panelists, starting with Larry. So Lawrence is the gentleman that started Get Set Up, and I've gotten to know him over the last year. He is phenomenal. His program has taken off. He is serving a lot of folks. I think he's racing to keep up with demand, and it's exciting to have him on this panel. So thanks for your time, Lawrence. And with that, sir, we'll turn the floor over to you.
Terrific. Thank you, Lance, Mary, Fred. It's a real pleasure to be here alongside Greg, Abby, and Dora, who are all doing very, very special work in this category. So Get Set Up is a social learning platform for older adults. And we've taken a very different approach in that we reskill and upskill older adults who then teach other older adults the things they need to learn to live happy, healthy, more connected lives. And we do this in a very interactive sort of video format, as we think our generation learns better by doing than by simply watching. And if you really think about it, the pandemic has obviously underscored the digital divide that our age group, older adults, that they face. And with folks even more isolated, the need to access almost every service virtually has become quite important. So at Get Set Up, we quickly rallied to help older adults learn how to use whatever smart device they had at home to get into their first Zoom class, which opens up a whole new universe of things that they can learn. But we started with essential services like ordering food and groceries, helping them get their medication delivered, teaching telehealth services so they could access their doctors, book Uber rides, etc. This then expanded to thousands of hours of classes every week in different time zones, in different languages, and across 15 different categories. And as we did this, we reached out to states and their departments of aging and health and human services to partner to provide their older adult populations access to these interactive classes to help them with both the things that they wanted and needed to learn. So, we are certainly super excited and pleased to be working with forward thinkers like Greg in the state of New York to empower their older adults in exactly this way. It's important to note that when you provide somebody access to information and classes, oftentimes sort of essential or critical services, you're having a profound effect on the social determinants of health. And if you can teach a skill that allows somebody to earn additional income or to learn how to use an app where they can now order food or take a class on how to use telehealth services or manage a chronic condition or exercise at home, cook more healthy food, use a vaccine registration website, you're really helping them live a healthier, more connected life. And while we have many important state partnerships, New York being a great example of one, we've now become a health benefit, and we're being offered to 70 plus Medicare Advantage plans, and there are 18 million eligible users. So we're super excited about this. And helping these Medicare Advantage plans onboard their older adults, understand how to use and maximize their benefits, learn how to use the plans, apps, and websites, and their telehealth services, are just as important as the general health literacy and mental enrichment classes that we're going to offer their members as well. And so if Get Set Up can help plans provide an even more holistic health offering and keep their members healthy, whether or not they can get to the gym or from the comfort of their own home, we think everybody wins. And again, we have a happier, healthier, more independent older adult, and ultimately a lower cost of care. So again, a great outcome, sorry. So we're really proud to provide these services to states like New York and Michigan and Wyoming, South Dakota, et cetera, and to the Medicare Advantage plans and to many other organizations. And the interesting thing about our service is it's for older adults, but it's powered by older adults. And we're very, very pleased that we can be part of helping solve what is a very big problem, and we think an exciting opportunity. So that's what we do at Get Set Up. Now, turn it back to you, Lance.
So I want to chime in here because I saw some data this morning from Leading Age that said what older people most wanted was to be seen as stakeholders in our culture. And I've been watching the fast growth of Get Set Up, and I think what's been so impressive is the job creation for older adults within that environment. So it's both an economic development initiative as well as a health initiative. And health, wealth, and self is something that ARP thinks about a lot. So do you want to comment on that?
Sure, I'd be happy to. I mean, I think that's exactly right, Mary. We think that, if we can empower, older adults to help themselves to live healthier, more independent lives, to help others like them, it's a wonderful outcome because, rising tides lifts all boats. And it's a very, very significant problem that we're attempting to solve. It's with a very large portion of the population, which is why, a conversation like this today with the stakeholders we have around the table here, who all represent very, very sort of interesting perspectives, is a great conversation to have.
I've been doing the cross-country travel for decades. I've never seen Washington move this fast. I've never seen states move this fast. And you have some pretty impressive investors out here. Do you want to talk a little bit about Eileen Lee and how she got involved in the company? And then I want Lance to talk about why is it that state governments are moving so fast, and why is it that the federal governments are moving so fast? So tell us a little bit about your investors, because they're also partners in this effort.
Sure. We're very blessed to have a great assortment of investors that help us think through perspectives from the technical, the aging space, the healthcare space, and very blessed to have folks like Reid Hoffman, Jerry Yang, Mark Pincus, Abby, who's with us today, is very, very helpful when we're thinking through a lot of our approaches and our go-to-market strategies. And more recently, Aileen Lee from Cowboy Ventures has joined as an investor and is going to be very, very helpful as we think through sort of how do we scale this business, how do we enter other markets, how do we turn this into a really big business that really does impact a lot of lives of a lot of older adults.
So Lance, why is everything moving so fast? Because it used to be if you told an investor in California that you're going to do a deal in Washington or at the state level, they would say, right, well, give us a progress report a year from now. That's not true anymore, right?
Yeah, you're right, Mary. And I think the reason is we all started listening to Mary Furlong. And no, I can tease you, Mary. I love you. No, your point's a good one. I think, it's a combination of things, just the speed of life anymore, right? I mean, we aren't patient. We want to see things done. And in some cases, that's not bad. As Greg will attest, I think that the pressure again on states means we got to try to move and get things through the pipeline quicker because that pressure just keeps mounting if we don't. And then I know at least at the federal level, we've sort of learned, and maybe the pandemic taught us that flexibility can be pretty important. And I know as again, states have seen, so many recent decisions because of the pandemic that you're seeing out of the federal government have been unprecedented in terms of just the volume of relief funds, how those funds can be spent, and again, really a true up in terms of federalism, where the federal government supports what we know and acknowledge the state believes to be the best fit for how we serve our citizens. So, I think, and technology, of course, has a big role in all that too. Now that systems are better synchronized, and we're seeing kind of the outcome of that. But I think again at the federal level, there's an excitement that again is fairly new, that we can at the federal level move much quicker than we have historically. Whether that again boils down to policy development, program decisions, funding, and it's pretty exciting that we're finally to that point. And some of that too could be just the nature or a blending now of non-career politicians, folks that come in from the private sector. Folks like Larry and Dor and Abby and others that maybe take on a federal leadership role, and they're like, things don't need to move this slowly, right? Let's get these things moving. So I'm excited. I think we have great times ahead.
And Greg, do you want to respond to that too? Because I was really impressed at how many partnerships you have put in place.
Yeah, so I mean, I agree with what's been said. I think what was really unprecedented is there were such high needs that needed to be addressed immediately. You couldn't wait. At the federal level, at the state level, and I can only speak to the organization that I'm honored to be able to lead. We've never sat back and dragged our feet. We should be innovating and evolving all the time. And if you are just an inbox person doing the same old for the last 40 years, then I'm the wrong person for the job. We have an opportunity, whether it be pandemic or not. Many of the things we started were pre-pandemic. What wound up happening is because there were such amazingly high, very complex and diverse needs, we were able to act on those very quickly. And I will not ever underestimate how important the various stimulus dollars were, because traditionally, and Lance can attest to this, dollars come to the federal government, to my organization out to the counties, and it's up to them how they use it. This gave me an opportunity to tap dollars that I traditionally wouldn't have, and then was able to just make things happen based on who wanted to be involved in it. And of course, people want to be involved in doing new things that meet needs differently when the traditional ways to do that weren't working or couldn't work because of the pandemic.
So let's turn now to Dor. And we've been following Dor's story in intuition robotics from the beginning. He's learned a lot about launching products into the sector. And I want you to tell your story and how you landed on SDOH as part of that story.
Sure. Thanks, Mary, and a pleasure to meet everyone. I have to say that we haven't worked with the federal government until now. We're the state governments, but after listening to Greg and Lance, I think that should change. So at Intuition Robotics, we approach this problem from a different perspective. We build a product called LEQ. You can see over here next to me. LEQ is a digital companion that lives with older adults, and she helps them stay independent and healthy and happier in their own home. It's the first product which is truly a companion and a proactive one at that. We work with now hundreds of older adults in the United States that live with LEQ. And she approaches them in the morning and asks how they slept and how they're doing and acknowledges their presence, initially as an intervention for loneliness and social isolation, but then grows from that to help bridge the digital divide and connect them to a whole bunch of SDOH related activities and to health and primary care. So think about this empathetic companion, checking up on people, talking to them, engaging them, acknowledging them, and then offering them wellness activities like mindfulness or physical activity that we do together with our partner Silver Sneakers, or hydration support or nutrition support, and other type things. She connects them to basic needs, like we help order rides or get food delivery or handyman services to their home so they can stay independent in their own home without needing, I guess Larry hasn't gotten to everybody yet, right? So using applications is still really, really hard, especially to the type of people we work with, which are predominantly in their 80s and 90s and have maybe a harder time navigating technology. We connect them to their families and update their families how they're doing, but also add just seamless communication with their family and caregivers. And then recently we started working with primary care, such that primary care can actually tell LEQ what to look for. And through conversation on a daily basis, we find out what's happening, and with the permission of the older adult, update their doctor. So that might be finding a change in clinical condition, like somebody isn't sleeping well or isn't feeling well, or it could be monitoring their vitals and helping them track their medication. And then finally, we just help them consume digital content, right? Music, news, sports, games, all with a lot of humor and a lot of fun. And what we found is that actually older adults, again, many in their 80s and 90s, all of them live alone, are using this product 5 days a week. They're interacting with LEQ 16 to 17 times every single day, spending about 20 minutes of pure interaction with this product, through which we fill their day. We hope to delight and help teach them new things, but also collect really important information for the ecosystem to help them stay healthier and happier at home. And to Mary's point on how we got to SDOH, it really started as an intervention for loneliness and social isolation. And once we saw that older adults started really kind of leaning on LEQ as a hub of sorts to connect them to the outside world, it started being really obvious that on one side, when people tell us they're not feeling well, we should let their doctor know, and we should help them manage their chronic diseases, knowing that about 80% of older adults have at least one chronic disease, but also help them with whatever they need in order to stay healthy. And to Lance's point, the health intervention, the direct clinical intervention, is responsible only for part of what it takes to keep people healthy. So eating well, exercising, having access to mobility, connecting to their friends and family, teaching them new things. All of those things are crucially important, and we try to do our very best to address these, sometimes through partners, but more and more just as LEQ as a gateway to the outside world. And what we're doing now actually is we're offering this completely free of charge when we partner with organizations that want to bring this to older adults in their networks, because we just frankly, as we scale, we want to get more and more users so we can train our AI models. Everything is completely AI driven, so we need more users to continue training our models, but also because we believe that older adults shouldn't necessarily be the ones that need to cover the bill. There are enough people in the ecosystem that can benefit from their full participation in the digital economy, or get the benefits of lower cost of delivering care, that can actually fund this. So anybody that wants to can sign up, and as long as they live alone and are over 65, they need to have Wi-Fi, Greg. So about 15% of the users that ask for an LEQ don't have Wi-Fi. That's still a huge problem, I think, from a policy perspective. But anybody that wants it, that meets that criteria, can get an LEQ.
And can you talk a little bit about your investors? I watched Toyota from the beginning, but you have an A-list here too.
Yeah, we're really happy to be supported by a combination of both corporates and traditional venture capitalists. We raised about $58 million to date. We're a team of 100 people working for almost 6 years now on building this technology. And indeed, it's interesting. This is such an important topic, and it's important worldwide. I mean, we're only working in the US for now, even though the company is headquartered in Israel. But people like Toyota and Sompo, which is a large life insurance company out of Japan, recognize the big perils of the aging population. And Japan is the oldest country in the world as far as population is concerned there as well. And it's very clear that technology is needed to help address that. There are just not enough caregivers available for the size of the aging population there. Companies like Samsung, companies like iRobot are all corporate investors. And then we have more traditional VCs from California, Israel, and some other places as well.
That's a good segue to turn to you, Abby, and tell us about Primetime Partners.
Thank you, Mary. It's always such a pleasure to be with you and the very inspiring group of people that you assemble. We've heard from a couple of people, great presenters today, on what's happening with social determinants of health. And from where I sit, I run a venture fund that focuses on the quality of living of older adults. We invest in early stage businesses that really move the needle on helping older adults with their health, their financial security, and having meaningful experiences. And we spend a lot of time looking at social determinants of health because it's so wonderful that our healthcare system is now recognized and is funding different SDOH benefits to the benefit of our of so many different audiences. And what I wanted to share today is really what's going on linking SDOH to supplemental benefits. Because unless it's paid for, it's very hard to roll out and to engage audiences in so many of the needed behavioral health areas that would really change health outcomes. And so what's really interesting, and it's unfortunate that it took COVID to, I think, accelerate what was already happening with CMS, but there is really been this dramatic increase in Medicare Advantage plans offering additional supplemental benefits. In fact, since we're already in annual election period, or AEP, for Medicare Advantage and Medicare right now from October through December, what we know already is that benefits such as meal deliveries has increased from 55% of plans in 2021 to 68% of plans in 2022. And this was really, in some ways, I think, heightened by COVID, because people understood how critical it was to reach seniors, particularly those addressing food insecurity. And that is the same for nutritional counseling, which doubled in penetration in MA plans between last year and next year. And the reason this is important to us at Primetime is we believe food as medicine is a really important piece of the health equation. We've invested in one business in the space called Project Well that serves health plan members with a combination of nutritional counseling and meal deliveries. And we're continuing to make more investments in the space. Another area that is often talked about are transportation benefits. About 39% of plans offer transportation benefits. We recently made an investment in Safe Ride, which provides non-medical transport to healthcare appointments and other needs that seniors have. And we just forget how important transportation is to be able to, both on affordability as well as mobility. And so we're really thrilled to be participating in this piece of the sector. Fitness is an obvious one. Fitness has been a social determinant of health that I think has been widely recognized and funded to date. And the real question with fitness is engagement. And so Lawrence may have mentioned with Get Set Up that fitness is actually one of the most popular content areas on Get Set Up. Because it's widely accepted that it's not only important for health to engage in physical activity, it's also fun. And so we're seeing a lot more fitness offerings focused on seniors that make it fun and easy to get started and meet people where they are, as opposed to being intimidating or more of a eat your carrots or broccoli, which is typically how fitness has been approached. And so the moving then to this area of social isolation, which then leads to mental health and other types of SDOH benefits. We're really seeing that people understand that social isolation is a health issue, not just an environmental issue. And so it's so wonderful that the speakers today have been addressing this head on, particularly Greg in New York State and all the work you're doing there. So I guess I would just close with saying, some of the things I'm seeing, we've looked at about 800 companies over the past year and a half. And some of the things we're seeing in the startup community is this real emphasis on enrollment. So it's great to have these wonderful products and offerings and benefits for older adults. But if you can't reach them where they are to try something new, it's really a challenge. And so that's something we're seeing a lot of companies innovating, whether it's call centers, text, Facebook advertising, YouTube advertising, a real way to reach older adults where they are. And then the last thing we're seeing is really how you operate at scale. While there's a lot of these are, new businesses or technologies, it's still a people business. Engaging with and helping older adults, you need people, you need call centers, you need support teams, case managers, caseworkers. And that's really where the public-private partnerships can come in beautifully as well. So it's a lot going on, and there's only more to come as we look at 2022 ahead.
Mary, that was awesome. I really wish we had connected much earlier than now. I'm so excited to hear about the work that you're doing. You're such a champion. You gave a whole lecture in about 5 minutes on the value of social determinants, what matters. And again, that's exciting stuff. So thank you, thank you, thank you. We have just about 5 to 7 minutes left. So what I'd like to do is just throw out a question to each of our 4 panelists. And if you wouldn't mind just offering a real quick, succinct answer, then we'll have Mary close. And, we'll circle back and maybe just go in quick order. So Greg, again, I think maybe my question that I'll select for you involves how do you manage the demand for folks that live in the rural parts of New York? I know that most of us who've not been to your beautiful state think about New York City, and that's all we think about. But I understand you have a very rural state. So can you quickly address how do we handle health equity, particularly around the rural setting?
Yeah, it's a great question. 42 of our counties are designated rural statutorily. We are not New York City. The landmass is huge here. There's pros and cons in a rural area. Everybody thinks, oh, you don't want to live there. They don't have the resources and the assets. That's not always true. There's things like broadband and lack of density and geography that definitely make a difference. But the infrastructure, both on the health and social service side, is much tighter because there's less and everybody knows everybody else. So we're literally dealing with this as we speak, and so are many other states across the nation, and dealing with healthcare inequity and access to services. So I think broadband, again, I go back to the federal bill that was passed, how huge that's going to be for not only New York State, but for the whole nation, and being to access these services. I also think, from my lens, the investment in aging services, the partnerships you can have with Medicare Advantage, MLTC, mainstream insurance, the business community. And I talk about this, and this isn't a quick answer, but 83% of all the economic activity generated in the country is for the 50 plus population. And so it's an incumbent for the investments to be in helping keep older people in their homes and communities off Medicaid, happy, healthy, and well, because there's a local, regional, state, and national economic benefit to that, because they're the backbone of the economy.
That's awesome, Greg. Thank you so much. Very, very good information packed into about 90-second answer there. Let me then ask the same question then of Lawrence and Dor, because again, both of you have really been engaged in getting a company off the ground, moving quickly. You're doing phenomenal things. Your growth rate is crazy. So for those that are participating that really want to be where you're at, what advice would you give for those that are sort of wanting to get into this market, wanting to approach VCs, wanting to really excel in offering a product or service to the aging community? So Lawrence, if you'll tackle it, and then Dor, take over from there.
Sure, I'd be happy to. Thanks, Lance. I think we came at the problem thinking, let's not worry about scalability initially. Let's solve the true problem. And we thought, if getting older adults online in many cases for the first time, because if you don't solve the first mile problem, you can't solve the last mile problem. So using Abby's phrase, like, meet people where they are. If they have some smart device and we can help them get comfortable with it, we can help them use it to get into sort of their very first class, help them turn on the camera for the first time, ask their first question. It opens up a whole new universe. And so we thought, let's do anything it takes to get older adults into these classes, even if we have to do a lot of heavy lifting, which in many cases can require us to go from the phone to FaceTime and get them into a Zoom session over the course of an hour. And we've done this tens of thousands of times, but if you do it, you've truly passed a really important milestone where you've now made them digital. Once you do that, it opens up a whole new universe. And so we've really decided that it's important to solve that problem because it opens up the door to solving so many others. And so don't have to sort of think about being a huge scalable business right from the outset. Solve the important problems and the rest will fall into place.
I would agree with all of that. What I would add is also, when we build tech products, the people building and designing it are not necessarily older adults. And it's very, very hard to put ourselves in the position of the people we're trying to serve and help. So bring them in early in your design process. When we designed LEQ, we worked with over 1,000 older adults, getting their input in every piece of the design. We now have, we've never shared this before, I think. We have 10 people that are our beta testers for every release. Every release goes out every 2 weeks. It first spends 2 weeks with our beta testers, which are our super users in their 80s and 90s that test the product for us. We have sensitivity kits that help simulate arthritis and muscular deterioration and issues with hearing and eyesight that our QA team works with and our conversational designers and so on work with. And I can't stress enough the point that we need to make products, innovators in this space need to make products for older adults that are designed for them to be delightful and not geriatric and to be amazing and wonderful. And the only way to do that is to include older adults into every step of that process and really, really listen to what they tell you.
All right. Hey, thanks so much. That's a great answer from both of you. I can't wait to meet LEQ. I'm going to check that out when we're done with this webinar. Let's wrap up then with Abby. And again, Abby, gosh, thanks for being on this panel. You, of course, come at this from a different perspective. You're an investor. You want to make sure that you help companies like the ones we're talking about here with both Lawrence and Door. You want to help them be successful. You have a passion for this. Again, for those that are participating, if you were to boil it down, what does it take to really convince you that a company's strategy is worth investing in? What are the sorts of things that you're looking for? Bottom line, what advice would you give a listener for today's webinar?
You give me the hardest question, Lance. Listen, there's some things that are generic to any good venture investing. And that means amazing team, a product that really works, and the ability to sell to whomever the customer or the end user is. I think something that's specific, though, in the space of older adults is something that Dor just said around really understanding user needs. And there's a lot of different segments within older adults. It's like saying people age 0 to 50 are the same as people age 50 to 100. I mean, there's so many different people to design for. So one is really understanding the segment of your audience you're going after and designing for them. And then I think the second piece is recognizing that a technology-only business only gets you so far. And so as Lawrence said, one of the things that Get Set Up does is they spend a lot of time supporting people in terms of onboarding and using products and services. And I think we have to remember that, while venture capital always looks for, great margins because it's all technology, that there's really a benefit in this market to human service and human empathy and compassion. The last thing I will say, and this is to Greg and Lance, your experience, is don't forget about the government. The biggest customer still is the government. The government provides the most money to older adults in a variety of forms. I work closely with the NCOA on a lot of different projects and continue to look for other organizations to partner with. And so, just because we are for profit in the venture capital world, don't forget that there's some amazing resources and learnings in terms of partnering across social services and the government.
Thank you, Abby. Well stated. And again, grateful to this full panel. What a remarkable conversation we've had. Mary, I know that this is being recorded. We need to make sure a whole lot of people hear this great conversation. I find it energizing. Again, it's critical. If we think about really the evolution of healthcare in America, we can't walk away from a conversation like this and not appreciate the impact that we know addressing social determinants will have on Americans. So again, thanks to all the panelists. Mary, I'm going to turn it back over to you to close us down.
Yes, I've often said that the internet 30 years ago is where the longevity revolution is today. But there was a magazine called Upside that had a picture of an orchestra. I think I was in the tuba. And what I see here is an orchestra of talent from so many different places coming together at rapid speed around innovation. So I thank everybody. It was a brilliant panel. And I think 2022 is going to be a great year. And I hope that we can facilitate you each meeting each other and having follow-on conversations. So with that, I thank you, Lance, and over to you, Fred.
Well, thank you, Mary. Really another terrific panel. So much great information. Applause for all of you. Lance, Lawrence, Dor, Abby, and Greg, Mary too. Just a great discussion. We also want to thank our sponsors, and to our attendees, thank all of you for watching and taking part in the What's Next Longevity Innovation Summit.